3 years since the pandemic began, over 16,000 New York children are estimated to have lost a parent or caregiver to COVID-19. Nationally, more than 300,000 kids suffer the same. One group of lawmakers and advocates spoke exclusively to NBC New York before announcing a potentially historic new bill that could ensure those grieving orphans are not left behind in New York State. Queens resident Chris Kotcher is the founder of COVID Survivors for Change, a nonprofit raising the voices of those coping with health and financial impacts from the pandemic.
Children's Fund, which is a bill that would provide baby bonds, which are childhood savings accounts that will directly benefit children who've been orphaned by COVID, who've lost a parent or caregiver to COVID. And it's publicly funded savings accounts that when they turn 18, they can then use for starting a business, attending college, purchasing a home.
The bill, titled the New York COVID Children's Fund, calls for each eligible child to receive $1,000 placed into a savings account, with $1,000 added each year of eligibility until the age of 18, when these young adults can access the money.
I'm a big girl.
Black, Hispanic, and Asian families are about 3 times more likely to lose a caregiver to COVID. Along with State Senator Jamaal Bailey, Assemblywoman Catalina Cruz is proposing this legislation. Cruz was born in Colombia and represents Jackson Heights, Queens, one of the most diverse districts in the nation.
Hola, mi amor. ¿Viene usted cómo me le va tanto tiempo?
¿Y dónde andabas?
Yo andaba en Albany trabajando. He would help us with the food line. He would sometimes pick up food. He would sometimes pick up food for neighbors. This is the district with the highest number of undocumented kids in the entire state, undocumented families in the entire state. This is where the asylum seekers, the DACA recipients, this is where everyone comes. Higher education for many of them, for many of the kids in this community, is the way out of poverty, is the way into the middle class, is the way to survive, actually. And what I see this as is a different way to help them survive.
These government baby bonds are not entirely new. Last year, through the NYC Kids Rise and Save program, every kindergarten student attending a city public school received $100 towards a college savings account. In direct relation to COVID, California is the first state to launch trust funds, specifically for children who lost a caregiver. New York mother and long COVID patient Maya McNulty is the founder of COVID support groups Walking Warrior and COVID Wellness. She believes it's crucial to remember her fellow long haulers.
We didn't see this second pandemic of long COVID coming. Parents have also chose to unlive. And it's devastating because the children don't understand why. On May 11th, the World Health Organization will lift the restrictions surrounding COVID as claiming the pandemic is over. It is not over for the 16,000 plus children.
While this is a start for New York, this New Jersey resident and COVID Memorial nonprofit leader hopes this transitions to New Jersey.
My concern is for those, that are turning 18, let's say a year or 2 from now, the lack of benefits that they'll earn off of the baby bonds versus those that maybe have 10 or 15 years to go. What happens to those that their parents' death certificate doesn't say COVID on it? They won't be entitled to this baby bond either. So the reality is there's a lot more to be done, and I do hope that it does transition over to New Jersey and other states across the U.S. as well.
Right now, it's going to be hard to say that it will go through, it will pass. That's number one. One House bills, and it's been passed by the Senate, has yet to go to the Assembly, don't become law. There seems to be no great groundswell about it, but there really ought to be. And there is a reasonable desire for people to say, wait a second, we took the worst of it. How about helping us out? And $1,000, which is what this bill gives, ain't much.
With the cost of education and getting homes or housing, there's a lot that goes into next steps for these children. Now, this bill is good because it introduces something, but do you think there's still more to be done?
Oh, there's a ton of work to be done. But one of the things I'd like to figure out how we can tackle is the mental health needs of these kids. Your entire world becomes thrown upside down. Maybe you know the language, maybe you don't. There's so much. And I'd like to see a universe where mental health services are a mandated part of our education system.
Now, this is just the first step. This legislation is currently sitting in committee and still needs to pass through the floor, Senate, and Assembly before either signed or vetoed by Governor Kathy Hochul. Reporting for News 4 New York, I'm Linda Gaudino.